Good afternoon, everyone, and welcome to our Protect Our Province COVID-19 briefing for Wednesday, November 17th, 2021. We are live streaming from the traditional and ancestral territory of many peoples. We are grateful to live and work in Alberta, a province on the traditional territory of 48 different First Nations and the unceded homeland of the Métis Nation. Today's conversation is being shared in ASL. To ensure access to completely accurate information, closed captioning will be uploaded after the live stream is complete. This conversation for the public is being shared live on YouTube, Twitter, and Facebook. The Protect Our Province COVID-19 briefing is a regular panel of doctors and experts. We will endeavour to bring you timely, accurate updates on the COVID-19 situation in Alberta and take questions from the public and the media. The views of our panelists are their own and do not represent any institutions they may be affiliated with. We have collectively gathered here as concerned Albertans, attempting to ensure that everyone in the province has access to as much information concerning COVID-19 in Alberta as possible. As always, we will start things off with an update on the COVID-19 situation in our province. Welcome back, everyone, and before we dive into Alberta's numbers and look at emergency medical services within our province, I would like to pause for a moment and acknowledge the ongoing disaster taking place across the imaginary line that is our western border. From myself, an Albertan, I want every British Columbian to know that along with, I suspect, most of Alberta, we cannot begin to find the words to express our shock, terror, and deep sorrow for what you are currently experiencing. My town site suffered extreme damage during the floods of 2013 in southern Alberta, and I know significant portions of Albertans still carry that trauma with them today. The critical infrastructure, sense of personal safety, the mental health and well-being, and the livelihoods of your entire province have been shaken by the impacts of the atmospheric river that hit southern BC on Sunday. I know those impacts will go beyond what I personally can imagine at this moment in time. As much as this briefing is Alberta-focused, we have been fortunate enough to have guests from across the country, viewers from coast to coast to coast, and we share a close relationship with POP BC and other public health stakeholders in British Columbia. Time and time again, the pandemic has reminded us all that imaginary lines in the proverbial sand only separate us when we bury our collective heads and choose to ignore circumstances occurring outside of our own postal codes, instead of acknowledging the interconnectedness of our global reality. I bring this up for a few reasons, partially in deep sympathy and solidarity, but additionally as a dual call to action. In June of 2013, the BC government issued an official statement of solidarity and support within 36 hours of the damage unfolding in southern Alberta. And within 48 hours, Emergency Management BC had formally offered support to Alberta and Parks Canada, including a temporary bridge for the Trans-Canada, and they had already at that point placed emergency responders in our province to bolster our services within the mountain parks. As an Albertan, I can't help but wonder where our public offers of support are. I'm big on actions Albertans can take. I've issued many calls to you all to let your voices be heard by our elected officials. I believe this crisis requires another one of those calls to action. I cannot help but notice the silence from the GOA. No official statement, not an offer of solidarity, condolences, or support, at least not that I've seen. A couple of questions in question period today, which, let's be honest, most Albertans don't watch, and a tweet from the speaker about 30 minutes ago. It's not enough, and it's not okay. Protect Our Province Alberta has its foundations in advocacy, scientific accuracy, and public health. And make no mistakes, one of the largest, if not the largest, public health emergencies that is impacting us now and will shape our global health for the next century is the climate crisis, an emergency of epic proportions. As a province, we need to support our neighbors. As a society, we need to protect all of the tiny humans here today and those that will be here tomorrow. And we cannot begin to do that without acknowledging science and enacting meaningful policy. And I personally do not believe our elected leaders showing a modicum of human decency is too much to ask. We need science-based actions to protect us all from what is here now crippling our neighbors today and what could cripple us tomorrow. We need robust public health care, emergency services, and mitigation planning to keep our society moving forward instead of temporary band-aids. So I guess the long and short of it for today is check on our provincial neighbors and ask your MLA how our government can help. Now, with today's update on COVID-19 in Alberta, here is Dr. Vipond. Dr. Vipond?
Wow, Michelle, thanks. That was really important. An important preface to today's event. I think it wouldn't be a surprise to our audience to know that I kind of cut my teeth on climate advocacy before I got involved in COVID advocacy. And to be honest with you, the reason why is because it scares the shit out of me. We are in so much trouble, in no small part due to the fact that our government officials are not willing to acknowledge how much trouble we're in and are unwilling to do what needs to be done in order to protect us citizens. And that includes the BC government, who continues to push for new LNG projects, despite the fact that our world can't afford any new LNG projects. So yeah, this is what's happening there. In a lot of sad ways, it's not a surprise to me. I wish I was surprised. I wish I could say it's coming earlier than I expected. But this is the first probably of a series of very disruptive events, and these will not end until we get our house in order, until we get our CO2 emissions to zero and start to remove them from the atmosphere. Yeah. So on that happy note, let's keep fighting for climate justice. But then let's take a moment to talk about COVID. I've got some slides. I'm just wondering, bring those up. Yeah. So this is today's update. So our cases yesterday were 421, which is a 15.9% decrease from last Monday's 501. So the 7-day average continues to drop. It's 383, which is a 17.6% decrease from last week's 465. Positivity very flat at 4.31 compared to last week's 4.34. So overall, just looking at these leading indicators, positivity has been, you can go to the next slide. The positivity, I didn't put the positivity slide in there, but positivity has been extremely flat for a couple of weeks. But our cases per day have been slowly dropping, much slower than in previous ends of previous waves. I did a tweet storm about this on Friday last, and basically my personal belief is this has more to do with cold weather than anything, and probably schools as well, and the fact that we're no longer not adequately protecting our school kids. So the combination of those things. So I'll talk a little bit more about what we can do to accelerate this decrease and to try and prevent a fifth wave. We go next slide, please. So these are our hospitalizations. So hospitalizations, like the most recent accurate numbers were Sunday and Monday, which Sunday dropped -8 to 423. Monday was up +1 to 424. These are inpatients I'm talking about, not total hospitalizations. Yesterday had a drop of 8 to 416. But as everybody knows who's been watching this, those recent numbers tend to be revised over time. So I expect to find out that our hospitalizations have actually been pretty flat in patients over the last while. Our ICUs are also flat. Sunday was flat from 102 Saturday to 102 Sunday, and then yesterday a drop of 2 to 100. So very slow decreases on both of those sides. There were some pediatric admissions as well. And I'm just trying to remember, I think it was 2 toddlers or maybe 3 toddlers that were admitted. Let me see if I can pull that up. Yeah, it was 2 toddlers that were admitted in the last 24 hours as inpatients. No new ICU cases. Next slide, please. This is where you can see how the just the flattening of that hospitalization curve and the flattening of that ICU curve, which is quite different from the last two ends. Next slide, please. And deaths, I don't have a death slide. I'll just talk about that briefly before going on to the demographics. The deaths were three, one of those three being somebody in their 30s. This brings us to a total of 47 deaths under the age of 40. And so, yeah, this isn't just a geriatric disease. There are young people that are passing away from this. And just a hat tip to Matthew Black, who's been keeping track of these numbers. Now going to that slide, there's this is the demographics broken down per 100,000. And you can see that really still dominating the cases are those 5 to 11, which have the unfortunate combination of both being unvaccinated because they're not allowed to be vaccinated and being in schools where they're congregating indoors in like basically a mass gathering. So it's not really surprising to me that they continue to dominate the numbers, but there are things that we still can do. We still don't have universal masking in schools. We're still missing the K to 3s. We're still missing the ability to, or the mandate to keep their masks on when they're sitting at their desk facing forward. We're still lacking the acknowledgement of airborne transmission by our boards of education and instituting mitigation plans for improving ventilation and filtrations. All of these things we can do better and protect our kids. And of course, extracurricular activities, which have an exemption as well on masks. So that ends the update. I'll just do a quick short editorializing that I think everybody in Masks for Canada and a significant number in Protect Our Province, Alberta, heaved a sigh of relief this weekend when our Canadian Public Health Agency finally began talking about COVID in terms of airborne transmission and aerosolization of the virus. This is, in my mind, the biggest turning point in the acknowledgement of the science of this disease. I'm hoping that it makes a difference in improved mitigation measures and improved understanding by the public as to how to protect themselves. And even Dr. Hinshaw was acknowledging this yesterday. There is a bit of revisionist history going on. Just keep an eye out for that. This is a huge change. Don't let anybody tell you differently. We're still waiting for a response by Alberta Health Services. I think the team will be talking about that in this panel discussion that's coming up shortly. But we need to be protecting ourselves. And aside from ventilation and filtration, physical distancing, the other big thing we need to do is better masks. So get a really good, well-fitted mask. That could be taking a surgical mask and using a mask brace, double masking, or upgrading to a respirator, either an elastomeric respirator, which you can reuse, or one of the disposable ones. So, and that goes as much for the public as it does for healthcare workers and other workers. And for the first time of the pandemic, this recommendation aligns with that of the Canadian Public Health Agency. And I'm really thrilled to be able to say that. I'm turning it back over to you, Michelle. Oh, actually, before I quickly, before we go to that, I just want to say how much our paramedic colleagues, our EMS colleagues, how important it is to our healthcare system, how important it is to my job as an emergency doctor. We need to support this system. There's evidence that there are cracks in the system that are occurring, and I'm sure we're going to get into the weeds on this right away. But I just wanted to reiterate, as an emergency physician, like we are brothers in arms and sisters in arms with our paramedics, and I just want to thank you, Mike, and I don't know if Peter's there yet, for all that you do. So thanks for being on Team Alberta.
Thank you very much, Dr. Vipond. I started the program today talking about a large-scale disaster. And on the front lines of any large-scale disaster or personal medical disaster is our first responders, a team of highly trained, dedicated professionals who are only 3 digits away. Dedicated, self-sacrificing members of our society who historically have seemed to appear like magic within minutes of a phone call on our front doorsteps to offer their life-saving skills and support. At least that's how it always felt to me. Until recently. Lately, I've felt like not a day goes by that some jurisdiction within our province isn't experiencing a critical red alert situation, a situation in which no ambulatory services are available for the community or they are limited. A situation that not only has dire consequences for Albertans, but has unimaginably complex impacts on the humans who have chosen service as their lives' work. So with us today, we are going to start off with Mike Parker while we wait on our other panelist. If our other panelist does not make it here today, this is going to be the first one-on-one interview I have done on Protect Our Province, Alberta, Mike. It's really good that I'm trained as an improviser, and I am so happy that I have you here today because I have a lot of questions, and so do the folks at home. So if I could start with, could you please introduce yourself to everybody with us and tell us a little bit about those you represent?
Thanks, Michelle. And well, if I get the privilege of being the first one-on-one interview with you, it'll be a checkbox for me as well. So thank you so much. And Dr. Vipond, thank you as well. My name is Mike Parker, and I have the privilege of being the president of HSAA, the Health Sciences Association of Alberta. I want to thank all of those who contribute to protect our province on these COVID updates. They have been critical, and I need to recognize every member on the front lines of the healthcare system trying to hold this system together. Michelle, you commented initially on the crisis in BC, and if I could just say that since Sunday, this has been unfolding rapidly. And the lack of response from this province is disheartening. Know that from my position, from all of our members, our heartfelt for everyone in BC today, and I imagine we'll be involved at some point soon. It does impact all of us as members in this country, and I like how you've identified we are a boundaryless. There is nothing stopping this, and thank you for that. We know Albertans are being bombarded with misinformation and misdirection when seeking clarity on what's happening during this pandemic. And I appreciate how much time and effort you've put into trying to cut through the political motivated decisions, including the decisions to do nothing and to focus on the people of this province. Reaching out directly to Albertans like this is so important right now. Late this summer, HSAA started an EMS page on Facebook. The purpose of the page was to give people a snapshot of what's happening in ambulance services in their small communities and municipalities. Within days, we had media from across the province who were contacting us to do stories like red alerts or ambulances being dropped altogether in their communities because there aren't enough paramedics to staff the ambulances. Even better than that, people started using the information to engage their elected officials. And now municipalities are holding town halls as we start to see demand from them for the province to do something, anything during this crisis. And friends, we are fully a crisis within a crisis in Alberta. Albertans can no longer be assured of an ambulance to be available for them when they call. And even if there is one, it could be coming from over an hour away. COVID has made a bad situation even worse. And now that the weather is getting worse, which always leads to increased calls, but this has been getting out of hand for a long time. And we have heard smoke. We have heard increased temperatures, opioid crisis, COVID crisis, you name it, every other reason except we don't have enough people to respond to the calls that are coming in. Here's a quick rundown of the information that we were able to gather from our HSA EMS Facebook page. And I'm going to go back to last Friday, ending 0600 yesterday morning. So not even a full 5 days. Here's what we saw. Over 214 paramedic shifts that are unfilled in this province. There are 48 code reds in 19 different communities. In Airdrie, there were 9, Cochrane 7, Calgary 6. There are also what we are terming rolling red alerts. And they happen when multiple communities around one major center all start going code red. And here's the example. In Calgary, Calgary goes code red, and so does Airdrie, and Cochrane, and Okotoks, Black Diamond, High River, Prentice, and Strathmore, all reporting code red, all at the same time. Ambulances were dropped entire shifts in 8 separate communities, including 4 times in 5 days in the community of Caroline. When resources are spread so thin, our response times begin to increase. And there were 22 incidents where ambulance response times exceeded 30 minutes. There were 9 events where response times were greater than 60 minutes, including an ambulance being sent to respond to Calgary from the community of Vulcan, which is an hour and 20 away. From Lethbridge, there was a unit in North Calgary responding to a call. Now, in that scenario specifically, I'm not sure if Lethbridge came from Lethbridge or was trapped in Calgary because there was no other units in the area, leaving Lethbridge exposed. And here's what we need to do about this information. It's provided to us on a voluntary basis. And that means that the numbers are low. And when you hear me say at least so many times, it's because that's how it works. Not every event that is that critical is being reported to us. So at least that many times. HSAA has issued a call for AHS to share the truth, to share the information about what's happening in this province. And we have yet to see a single response. I'll stop there and let's look forward to some Q&A for a little bit. Michelle?
I am looking at my script, but at the same time, so much of what you just spoke about is raising not just red flags inside me internally and all of the waterworks that sometimes come with this program and anger. And in all honesty, I don't even know exactly where to begin. Like I said off the top, your members, at least for me growing up here in Alberta, almost seemed magical. You dialed 3 numbers, and for the most part, at least around the urban centers, within 3 to 4 minutes, these wonderful humans would be at your front door to make sure that you were still going to get to have dinner with your family. And so hearing you talk about over an hour in some cases in Calgary, a major, huge center, let alone for folks like me who live west of Calgary, that would be drawing from Cochrane or Black Diamond, who were probably trapped in Calgary. I'm not even sure. It is beyond terrifying. Please, Mike.
I was going to say, in the region that you've described, when you see a Kananaskis responding first unit in lights and sirens from Kananaskis to Metropolis of Calgary, that is a real scenario that does happen. Cochrane into Calgary, Black Diamond into Calgary. These units, that's what's happening. And the question I have, first I want to say, they are still magical, Michelle.
Yeah.
Trust me, they are. How they do this, I don't know, because responding an hour to a call, and in that time as they're responding, they are being updated from the scene. The family is still on the phone if they haven't been emergency disconnected by dispatch, which is a process that's happening now because so many calls are coming in, or dispatchers are forced to hang up on you to answer the next call. So as they're coming to you, they're being updated. And as we can imagine, in an hour's time, as it gets more critical and more critical, the descriptions are getting more and more desperate. And the paramedics know what they're heading into. The intensity level is so high by the time that they get there. But yeah, you're right. They are magical. Anyway, sorry.
No, please don't apologize at all during the time that we have together today. Let's talk about that for a minute. How are they doing? We hear a lot of news stories, but we also hear a lot of unfortunate silence, I think. With the odd sort of mention of lack of access to support. Obviously, with over 214 shifts unfilled this weekend, we are looking at humans who are stretched beyond a breaking point. I read an article today that told me that most first responders have access to 3 hours of paid mental health support, like with a counselor, during a calendar year.
Yeah. So the EFAP program offers you a telephone call counseling or a Skype counseling system. You're right. It's nowhere near what's needed. It's almost embarrassing that we have that as a piece to support our people. There is still a little bit of hang on in our legislation that says that paramedics do have access to presumptive PTSD. The downside is you have to be diagnosed with PTSD, right? So instead of protecting us before they get injured like this under the mental health strains that they work under, well, it's at least it's a step that there is some support. All of the supports for the remainder of our members was wiped out in an act of repeal from the current government, where they took away the access to presumptive care to our other allied workers that are on the front lines today. The OT piece is such a difficult one, and I'm going to try to coach myself here, Michelle. I'm going to do what I can. You're making it feel very comfortable to give you the full perspective here. But when a minister says, I'm going to release the cap on overtime, well, as you can imagine, there's already 200 and some odd shifts that are vacant. Overtime isn't going to change that. And the 10 or 15 phone calls every day from staffing for these folks saying, come back in for overtime, come back in for overtime. You know the system is failing. You know that if you put your uniform back on and walk back in, you're walking back into an absolute crisis where 30 and 45-minute response times are the norm, where you can't find time to eat a sandwich or have a restroom break because the tones are going off for the next call before you've cleared this call. And this is the environment they work in, where you are going from high intensity to high intensity. And in some point, you need to maintain your compassion, because nobody got into this job to be at that intense level for 12 plus hours a day. And when you call because your mom has a hip pain, you need the compassion of someone to walk in. And they are coming off of such an intense 3 hours prior, or who knows what. And you name it, the worst nightmare is what they see daily. That's their job. And they're going to come in and try to find that level of compassion when, and again, this sounds so simple. They haven't had time for a bloody coffee or a sandwich. And just to step off the ledge for a second and reset your mind so you can step back into that world and help again it's frustrating. And when I hear from them, the anger, the frustration is a symptom of a greater issue of their intense burnout that they're facing, yet they want to do the job. And we have vacancies. Like, fill the bloody vacancies so we can at least staff our ambulances to get to those calls, because nobody should have to respond an hour and nobody should have to wait an hour for paramedics to come through that door.
On that note, is this a situation that is unfolding from coast to coast to coast, or is there a uniqueness in terms of the number of vacancies that are happening in Alberta?
That is a great question. Do we see a rise in call volume across the country? What we see is a decrease in investing in our frontline services in healthcare globally. We see a reduction. We see a move to privatize. We also see this when you have a career that burns you so hard. Our members aren't surviving a career's worth of time. And so there's a decrease in members because they just can't maintain a career's worth of service anymore. In Alberta specifically, when AHS took over the system from municipalities in 2009, there was an immediate reduction in ambulances across the zones. They took one out of Strathcona, for example, one out of St. Albert, one out of Leduc, and expected Edmonton to fulfill that void. Well, we were already running code reds in Edmonton when they did this. This increased their zone coverage, increased the population, and that continues today. And what we find now is that there has not been any additional resources added, and our population call volume continues to grow. We're now 10 years plus later in this transition. We're not adding resources. There was an announcement from the minister who said, we're going to put another 100 people on. And that happened This summer, he announced that. Here's the reality. The 100 people they're looking at are already working overtime plus. And they're going to move them from not getting benefits to getting benefits. They're going to move them to full time. So that's great. It's about time they have access to their EFAP, access to mental health supports, access to these pieces. But they've already been fulfilling 40 plus hours a week. And they're just moving them into a benefit eligible program. It does nothing to the front lines. It does nothing to help response times in this province. So getting tired of listening to the constant, yeah, we're doing something, and I'm not seeing a whole lot of anything. Back to you, Michelle. Sorry, I don't want to.
No, we are generally a program that has just open conversations with a variety of panelists. And so since I am attempting to improvise my one-on-one hat, I will pretend to be a Ryan Jesperson or a Nate Pike for a moment. And I'm going to roll us back a little bit just so I can make sure that all of our listeners are sort of on the same page. Okay. So I'm going to hit you with a series of sort of smaller questions.
Let's do it.
Can you remind me again what HSAA stands for?
The Health Sciences Association of Alberta. We represent 29,000 frontline healthcare workers, from respiratory therapists to mental health therapists to your lab techs, paramedics, everything in between.
Can you now tell me, just that way we're still all on the same page, the difference between like a paramedic and an EMT and an EMR? I don't know that I fully understand how that system works.
That's a great question. Today, through the regulatory body, any individual working on an ambulance, frontline healthcare, is titled a paramedic. It was I'm going to guess it was a communications piece. It's just too bloody confusing, like you've just suggested. What does it all mean? Emergency medical responder is the name of the EMR, and that was a program introduced 20 years ago to start bringing people into the system to get some people in small communities working on an ambulance to respond and support their communities. EMT is emergency medical technician. It is a college level program that provides the next level of training on top of the EMR. You advanced through the EMT program. And then you have 2 more years to do what was called the paramedic program, but we now call them critical care paramedics, CCPs, ACPs. There's a couple of different balances there. Some other provinces have different jurisdictional lines on how they define them, but the highest level being the critical care paramedic. You might find those working on some flight crews. They have a little more advanced training for some more advanced equipment. The main system out there requires advanced care paramedic to be on an ambulance, giving it the advanced care level, and working hand in hand with EMTs or critical care, primary care paramedics as well. So these are the different phases of it. And what we see a lot of the time now, we're using the term downgrading, which is difficult to explain it. But when you don't have a paramedic to get on the ambulance, and what I'm talking about is a primary care and an advanced care. So when you don't have an advanced care paramedic on the ambulance, you downgrade it to a primary care level. There are less pharmaceuticals being accessed by that level of training. So rapid sequence induction or any of these other pieces that you'll find on a critical care or advanced care are not accessible through a primary care. And I hope I haven't walked myself into a circle here, but there are different levels. Let's just say this, there are different levels of training. The upper levels would be the advanced care paramedic, partnering with a primary care paramedic. And for the most part, our front lines of EMS, there are not that many EMRs or emergency medical responders currently in the industry or left in the industry, for lack of better terms. There are a few, but not too many.
Okay, I think that this is good. I am following along, which leads me to believe that other folks will be following along as well. Okay, so as a human in Alberta, could you talk me through, we sort of did a big overview of it in terms of now how ambulances are dispatched from anywhere they happen to be available. Yeah. But could you talk me through what happened when I called 911 3 years ago, and what happens when I call 911 for a medical emergency now?
Okay, that's a great question. We have 3 dispatch centers located in the province today that dispatch ambulances. And we have to split up because in Calgary, there was a time where Calgary emergency dispatch had police, fire, and ambulance. That has been moved off. We're going to talk about two things here. We're going to talk about how that dispatch system was and is, and we're going to talk about closest unit response, are two pieces that I'd like to cover with you.
Love it.
So today's dispatch model has all system EMS, whether they work private sector service or municipals like Calgary or Fort McMurray, or major centers like Edmonton and Calgary, are all tracked within one system. And if the Calgary Dispatch Center gets overloaded, they can share calls to Edmonton if they have space, or share calls up north to the North Communications Center. And they exchange and kind of back each other up as the busyness rises. And I'll be clear with you again, when I said emergency disconnect protocol means I am so busy in this center, there are so many phones ringing, I have to say thank you, they're on their way, and hang up, regardless of what we're talking about, because in the mind of a dispatch communications officer, the next call is the most important. They cannot leave calls to go unanswered. I know what's going on in this call. I need to get to the next one, which requires disconnecting because they're so busy today. From that, they dispatch the ambulances and they use a closest unit protocol. The way we are different from 3 years ago, Lethbridge might have dispatched their own ambulances, and then maybe Calgary dispatched their own, Red Deer their own. It's now all one system, which I would argue needs some tweaks. Let's be crystal clear. And it's not from our frontline members. They are doing all they can in this system, just trying to get by. They've got the same pressures that the paramedics on the street are seeing every single day. But in this system, a closest unit now we're going to talk about. I'm going to take you back to the early 90s when I was on the street. I'm in rural Alberta, and I would answer the emergency phone in my own house and say, hi, regional ambulance. I'll just leave the name of the town out. And I need to know which side of the highway your car has landed in a car accident, because it might be my private company, might be the other private company. We got to fight over whose ditch you're in. Today, closest ambulance is a fantastic concept. If you're driving past an incident, a pediatric cardiac arrest, hell yeah, I want the nearest ambulance coming. I want all of the nearest ambulances coming to my call. But what's happened is that once we start drawing in nearest ambulances, it becomes a Camrose into Calgary, and then maybe a Cochrane, and then maybe a Fort McLeod. And now we've sucked the entire system dry. There are no close ambulances. So the concept of closest ambulance is great. They're not close anymore because we don't have any. And so that's where it gets odd. And that's why when I said earlier, you see Lethbridge ambulance working north Calgary. Here's how that would happen. Lethbridge ambulance would be dispatched to the hospital to take maybe a CCU transfer to Calgary, heading up to a cath lab or something like that, kind of a system. And as they get there, they offload, they repair their truck, put it back in service. They're going to drive back to Lethbridge. Ding, they're the closest truck to a pediatric code in North Calgary, for example. Let's make it as intense as it can possibly get. Yep, the only truck left in the entire system is a unit that was doing a transfer 10 minutes ago and is now responding to North Calgary. Technically, they should be covering the city of Lethbridge, and they're not. So there's some of where we're at. If the system was managed properly, which they have no idea how to do, apparently, we would have enough paramedics on the street that truck would get back to Lethbridge, and the current level of service in Calgary would cover the calls that are needed, and there would have been a regional, a Calgary paramedic unit sitting close enough to that call in North Calgary to actually get there. But we don't see that.
And so how is that? I really can only imagine, from talking about the 911 operators to your members who are boots on the ground, how that is feeling. I could not imagine having to hang up on someone while their parent or grandparent was having a heart attack because I needed to answer the next phone call. I cannot imagine transporting someone critically ill from my hometown to suddenly having to be navigating rush hour in the middle of Calgary or Edmonton, way out of my normal route of practice, to hopefully make it on time to save someone else's life. Where are they putting that?
I need to stand tall, Michelle, and say, these are experts. And when they do their job, they do it with the utmost of passion and expertise. When a dispatch communications officer has to make that decision, I know damn well that it takes its toll. I know that when I could put myself back in the days of a community paramedic, and I'm heading into the city of Edmonton, and I don't even know where the hell the hospital is. Right? Like, my town that I'm coming from didn't have streetlights, and now I'm in South Edmonton trying to find the friggin' hospital. They have a way. They are experts. They can do this. They can give them a job. They will accomplish it. I guarantee you 100%. When they get there, they will give you everything that they have and then some.
There's a really huge part of me that feels like they shouldn't have to.
I wish we could.
How does Michelle, how does her neighbor, whose name we'll say is Emily, even though it's not, how can we help?
Okay. Why don't you and I have a conversation with Emily then? I think that's a great way to do this, because I can see that neither one of us is doing as champion as we should for a moment. So let's talk to Emily for a second. Say, Emily, my neighbor over the fence, I got to tell you something. Our paramedics, who we had trusted in protecting all of us in this province, are at a breaking point. They are exhausted. They are run to a level that we cannot keep them at, because it's going to cost them their lives. It's going to cost us our lives, and we need to help them. And what we can do in this point is to make sure others hear the story. So, Emily, I want you to understand what it looks like in your town. Come join me on the HSAA EMS Facebook page to understand. And if you see something you are concerned with, please take a moment, write a letter, pick up the phone, call your constituency office, talk to those in power, those who are in charge of this, and say, we need to start filling these vacancies. We need to have our paramedics taken care of so that they can take care of us, because in no way should we be asking them for 12 hours of frontline critical response, plus another couple hours of overtime because you're trapped in another city trying to get home. Because just put that stress on it. Good thing that their kids aren't in daycare, or maybe they are. For the fourth time, the daycare is going to toss them, right? They're humans. They have the everyday pressures that we all do. But you were right at the start. They're magical because they get it done. They get it done to save the lives of Albertans, and we need to save theirs now. We need to make sure everybody knows what the hell's going on here, and that we need to resource our members properly, because there is no way we should go code red ever in this province. Michelle, I want to go back to the code red for a moment. I'm gonna confuse our conversation with Emily for just a second.
That's okay. Emily will survive.
We'll send her a postcard after this.
Yeah.
But, you know, I was talking recently with someone about when we should expect to see something like a code red. And here's an example: tornado 1987. That'll put us on a code red. The Humboldt bus crash in Saskatchewan, that'll put us on a code red. You can't staff to that level of intensity. I get it, right? We don't have, that. But when code red is every hour of every day somewhere in this province, there is something wrong when it's become normalized. And we have to recognize that this is not normal or safe for us as citizens, for them as paramedics trying to get to us. They're driving lights and sirens. Hell, shut the lights off. I can hear the frustration. What's the point in driving lights and sirens for a friggin' hour? We can't be asking this of them. So those expectations that Tornado 87 would push us to a point of disaster, yes. They have pushed us to the point of everyday operations has become that disaster. So.
For my last question, I think, and then I'll offer you an opportunity to share any closing thoughts that you have. Sure. We've talked about sort of what average Albertans like myself or Emily could do in terms of following the Facebook page, in terms of talking to our elected officials around a need for increased hiring, moving people to FTE from, part-time so that they can have access to appropriate, not nearly enough, but at least some base services. It sickens me beyond to think about someone coming to save my life not having health insurance. I can't even get into that part of that conversation in the next 11 minutes. Otherwise, we will just never stop. But for the first responders at home who are watching, what would you like? I mean, as an Albertan, I want to remind them that they're valued. I want to remind them that I am so, so grateful for what has been offered to me because of their sacrifices. But as Mike from the HSAA, what services do you want to remind them that they have access to?
I wish there were more. I wish I had a list that was actually substantial. Our members have access to presumptive PTSD legislation that forces them into the WCB world. Our members have access to a few hours of mental health services outside of that, because to get into a true treatment program, you have to go through a WCB program. Our members are standing in hallways eating sandwiches at hospitals. They are looking for bathrooms at gas stations in between calls. They are
So just in case anyone listening at home isn't aware, since we've gone into slang, PTSD does stand for post-traumatic stress disorder, which we've noticed a steep increase in first responders over the last few years, a lot due to 14 hours of nonstop high adrenaline urgent situations that are truly life and death. And you can't save everyone, no matter how gifted, skilled, trained, or otherwise you are. Some things just can't be turned around. And that repeat exposure to extreme crisis, tragedy, and trauma can play an unimaginable and extremely significant toll on folks' mental health and well-being. I've heard from some paramedics in the Pop AB Twitter chatter universe that designation of pre-declared PTSD is not as simple as that.
No.
No. And so maybe you could shed some light on that for folks at home as well, because I mean, I know again today there were a couple of news articles about end of life decisions, suicides happening within your field. Yeah. Because we haven't, as a society, provided the supports that are needed for folks to continue to survive.
Michelle, I'm gonna try to walk through this one as best I can for you. The system is broken. Our members, as you've described, are responding to high intensity situations, and any battlefield commander wouldn't keep their troops in the trenches. Let's just do the COVID world of 20 months straight, because it's more than that. It's 10 years worth. But we've left them in these trenches battling, trying to get to your call and that intensity level. And then you get off shift and the phone rings 22 times for you to come back for overtime. It just never lets go. You don't have that chance to detach, to reset, because your brain can't take that level of intensity for a career without damage. The presumptive PTSD, and I apologize for your listenership. I didn't mean to step into slang there. Post-traumatic stress disorder, and I only because of a post that I read recently from the spouse of a first responder, I will state, just last week in a community not far from where I'm sitting right now in West Edmonton, lost a frontline member due to mental health, because they just can't continue at the level. And so when there is minimal support when there is no recognition from an employer, when there's a government that says you can do more with less, which means you're not doing enough now with what you got, work harder, vacation time, leave time being canceled because I can't give you the time off. So you can't even, when you are recognizing that you are failing, you can't even pull back respectfully. So the only option now is to, I'm going to use the term ring the bell for lack of better, and say, I give up. I need someone to look at me and say that I am in trouble here, which means now walking the path of WCB and crisis assessments and diagnoses that are, occupational stress injury versus post-traumatic stress disorder. And now I've got to go face my colleagues and family and say, what? How do I, as the person that can walk in your door and do something magical, turn to my colleagues and say, I can't? So, I didn't think we were going to walk this path, Michelle.
I thank you so very much, Mike, for walking this path, because I think I like to hope that one of the things that will come out of the tragedy that is COVID is a deeper understanding that we can't all keep going like this.
No.
That this is not a healthy society, that this is not a supportive society, that this is a society that buries its head frequently in the sand and chooses to not see things that could be fixed with meaningful policy and investment, and things that will serve all of us, including your individual members and Emily, my imaginary neighbor on the other side of the fence, because we're afraid to talk about it.
Michelle, I'm going to say this. I need people to not be afraid. I need people to stand up, be proud of their paramedics, be proud of the dispatch emergency system that we have, be proud of our healthcare system, because they have been battling in this COVID trench for over 20 months and they're not giving up. They're still going to work every single damn day. And so when you said, any last words, I'm going to say this. Don't give up on them. Stand tall, protect our paramedics, protect our frontline emergency system, protect our healthcare system. Keep it in the public hands. Defend them. They are defending you with all they have. It has been my privilege, Michelle, to spend time with you. I don't think we've ever met before, and I hope we have an opportunity to have a one-on-one conversation in front of I don't know how many people again one day. But I want you to walk away with this. Be proud. They are out there putting their boots on the ground, answering those 911 calls, receiving patients in hospitals, doing all they can to get you well and get you back to a life that you can be with your family and maybe even your neighbor Emily too. That's their goal. It had always been their goal, and they will do it as best they can. But right now, in this battle, they need everyone's help.
I would also like to, as we say goodbye, offer to my fellow Albertans, be just as proud when they find the voice to say that they need help. Because I think that's the only way we stay on a path where we can access the help that we need when we need it, is if your members have the robust support that they need to make it through every day. Thank you so much, Mike.
Thank you.
Yeah, I will end with, as always, this topic is too large to discuss in an hour. And I thank you so much for joining me and everyone who is listening and will listen over the weekend. On behalf of POP AB, I just want to say, as we approach the end of 2021, we will be continuing to tweak our briefing frequency. We pride ourselves on providing information to Albertans when needed and not talking just for the sake of hearing ourselves talk. So we are going to move to an every second week format for the next month and then take a hiatus towards the end of December. We don't like to spring things on people. But as always, if something needs to be highlighted, we will make sure to do it in a timely fashion. So please subscribe in whatever format you usually join us to be notified in case POP Alberta needs to pop up prior to our next scheduled briefing, which is currently slated to be Wednesday, December 1st, 2021. So until next time, stay safe, Alberta and BC. As always, I get to say this one with a little bit of a smile. Remember, COVID-19 is airborne. Wear the best mask you have access to, and vaccines really do save lives.